Think about this. What if one tiny detail you've had since the day you were born could quietly influence your risk of heart disease, certain cancers, blood clots, or even severe infections? Something you can never change. You can't exercise it away, you can't diet it away, and millions of Americans have no idea it might matter. It's your blood type. Now, before you panic, having a certain blood type doesn't guarantee you'll develop any disease. But over the past several decades, scientists have uncovered some fascinating patterns that suggest your blood type may influence certain health risks. Some blood types appear to have surprising advantages. Others may carry unexpected vulnerabilities. So, which blood type is considered the healthiest? And could yours reveal something about your future health? Let's find out. Welcome to Think Frontier, where science meets the mysteries hiding inside your own body. Today, we're diving into one of the most overlooked clues in human biology, your blood type. Let's start with the world's most common blood group, blood type O. If you have type O blood, you belong to the largest blood group on Earth. In the United States alone, millions of people have it. But what makes type O especially interesting isn't just how common it is. It's what researchers have discovered about its potential health benefits. Several studies suggest that people with type O blood may have a lower risk of developing dangerous blood clots. That's because they often have lower levels of two proteins involved in clot formation, factor VIII and von Willebrand factor. With fewer of these clotting proteins circulating in the bloodstream, unwanted clots may be less likely to form. And that's important, because blood clots are one of the leading causes of heart attacks, strokes, and pulmonary embolisms. Some research has even found that people with type O blood may have a slightly lower risk of coronary heart disease compared to certain other blood types. But every advantage comes with a trade-off. People with type O blood appear to be more vulnerable to stomach ulcers. One reason is that a bacterium called Helicobacter pylori seems to attach more easily to the stomach lining of some people with this blood type. Over time, that infection can damage the protective lining of the stomach, increasing the risk of painful ulcers. Researchers have also found evidence suggesting that type O individuals may experience more severe bleeding after serious injuries or major surgery. Since their blood tends to clot a little less aggressively, controlling bleeding can sometimes be more challenging. So, while type O may offer some protection against dangerous clots, it may also come with its own unique risks. Now let's move on to another fascinating blood group. Blood type A. People with type A blood have attracted a lot of attention from researchers over the years, and for good reason. Several large studies have suggested that type A may be associated with a slightly higher risk of cardiovascular disease compared with type O. Scientists believe one possible explanation involves those same clotting proteins. People with type A blood often have higher levels of factor VIII and von Willebrand factor. Higher levels can make blood slightly more likely to clot. That doesn't mean a heart attack is inevitable. Far from it. Lifestyle factors like smoking, diet, exercise, blood pressure, cholesterol, and diabetes still play a much bigger role. But blood type may be one small piece of a much larger puzzle. Researchers have also observed another surprising pattern. Some studies suggest that people with type A blood may have a slightly increased risk of stomach cancer. Why? One theory points once again to Helicobacter pylori. This bacterium appears to interact differently with certain blood group markers found in the stomach lining. Over many years, chronic infection and inflammation may increase the chance of abnormal cell growth. It's important to remember, an increased risk is not the same as a prediction. Most people with type A blood will never develop stomach cancer. These studies simply describe statistical trends seen across very large populations. Your daily habits, regular medical checkups, and family history remain far more important than your blood type alone. But if scientists are seeing these patterns, what about blood type B? And what makes the rarest blood type on Earth so unusual? The answers might surprise you. Blood type B. If you have type B blood, you're a part of a much smaller group than type O. And while scientists are still uncovering the full picture, several studies have linked type B blood to a slightly higher risk of developing blood clots than type O. One possible reason is that people with type B often have higher levels of clotting proteins, including factor VIII and von Willebrand factor. Those proteins are essential for stopping bleeding after an injury, but when levels become higher than necessary, the blood may be slightly more likely to clot when it shouldn't. A clot forming inside a vein or artery can block blood flow, potentially leading to conditions like deep vein thrombosis, a pulmonary embolism, or even a stroke. Again, this doesn't mean everyone with type B blood is in danger. For most people, everyday factors like staying active, avoiding smoking, maintaining a healthy weight, and controlling blood pressure have a much greater impact on overall health. Blood type is simply one piece of a much larger puzzle. Blood type AB. Now we arrive at the rarest of the four major blood types. Only a small percentage of people have type AB blood. But despite its rarity, it has fascinated scientists for decades. Research suggests that people with type AB may have the highest average levels of certain clotting proteins among the major blood groups. Because of that, some studies have found a higher risk of blood clots compared with people who have type O blood. But that's not the only surprising discovery. Some research has also found an association between type AB blood and a slightly increased risk of memory problems or cognitive decline later in life. Scientists still don't know exactly why. One theory is that changes in blood flow and clotting may affect the brain over many years. Another possibility is that the genes controlling blood type may also influence other biological processes that researchers are only beginning to understand. The truth is, this area of science is still evolving. Many questions remain unanswered, and that's exactly what makes it so fascinating. So, which blood type is the healthiest? The answer: there isn't one. Every blood type has potential strengths, and every blood type has potential weaknesses. Type O may have a lower risk of dangerous blood clots, but a higher chance of stomach ulcers and increased bleeding after serious injuries. Type A has been linked to slightly higher risks of certain cardiovascular diseases and stomach cancer. Types B and AB may be associated with a greater tendency for blood clot formation, but none of these findings determine your future. Your blood type is something you're born with. Your lifestyle is something you choose every single day. Regular exercise, a balanced diet, quality sleep, managing stress, avoiding tobacco, and keeping conditions like high blood pressure, diabetes, and high cholesterol under control. Those choices have a far greater influence on your long-term health than your blood type alone. In other words, your blood type may load the gun, but your lifestyle often pulls or never